You have probably felt that burning sensation in your muscles or a little stiffness after a great workout, right? That feeling often signals progress and strength. But what about when it is more than just discomfort? What if it is a signal that your body needs you to pay closer attention, especially when you are focused on preparing your body for conception? When it comes to exercise and your fertility journey, you should immediately stop if you experience any sharp, sudden, or persistent pain. This kind of pain is very different from the usual muscle fatigue you feel during or after a good workout. Key areas to watch for this red flag pain include your joints, your pelvic region, and your abdomen. The reason this distinction is so important lies in understanding your body's natural warning systems. Muscle fatigue is a sign of healthy adaptation and growth, often due to lactic acid buildup. It is a temporary sensation that lessens with rest. However, sharp or sudden pain is your body's direct way of signaling potential injury to ligaments, tendons, or even internal structures. When preparing for conception, avoiding physical trauma and excessive stress on your body is paramount, as these can divert your body's resources away from reproductive readiness. Protecting your structural integrity now lays a crucial foundation for a healthy pregnancy later. So, how do you know what kind of pain requires you to hit pause? Look out for any pain that feels sharp, stabbing, or like a shooting sensation, especially if it gets worse with continued movement. Any localized pain within a joint, such as your hips or knees or around your pelvic floor, should be carefully considered. Beyond pain, also stop if you experience lightheadedness, dizziness, shortness of breath beyond what is normal for your exertion, or any persistent cramping in your abdomen. For a definitive stop, always cease activity if you notice any vaginal bleeding or unusual fluid leakage. If you experience any of these symptoms, the best action is to stop, rest, and assess how you feel. If the pain or symptoms persist, it is always wise to consult with your healthcare provider. Embrace the idea of listening to your body's whispers before they have to become shouts. This practice is often called proprioception, which is your body's amazing sense of its own position and movement. Developing this keen body awareness now is an incredible asset, not just for safe exercise, but also for navigating the physical changes and demands of a future pregnancy. It is an insider skill that helps you differentiate between beneficial challenge and harmful strain, building a resilient foundation for your reproductive health. Ultimately, choosing to stop when your body signals distress is a smart, proactive decision for your well-being, not a setback. By prioritizing your body's clear communication, you are actively protecting yourself from injury and optimizing your physical state. This attentive approach builds a stronger, healthier foundation, preparing you effectively for a smooth conception journey and a thriving pregnancy ahead.